Welcome to Health Talk Live Talk Show. Viewers, we all know health is wealth and precaution is better than cure. Without any further delay, I would like to invite my co-host Dr. M.S. Cover, Senior Consultant, Pulmonary Critical Care and COVID Team in Apollo Hospital. Welcome to the show, Dr. Cover.
Hi, Rashmi. How are you doing today?
I'm good, Dr. Cover. Today, our viewers are very excited for today's show because, of course, dental is such a main issue these days, and I'm really glad that we have two doctors with us, and I would like you to invite them.
Yeah. Though we talk a lot about the COVID and the COVID times, but dental uh, field in particular that has got a hit actually. A lot of dental clinics were closed, and they started reopening up with a lot of precautions. And we'll be talking about that. We have two very eminent colleagues of mine, and we've been working together for a very long time, decades actually. And they both have a fantastic experience behind them. Let me introduce to you Dr. Neeraj Varma. We've been together for 25 years in this hospital at Apollo Hospital. He is the clinical director and dental services in our hospital, and he's specialized in periodontics, orthodontics, and implant dentistry. Before joining Indraprastha Apollo Hospital, he was in Indian Navy. So we'll probably talk a little bit about his experience in
Of
both
course.
the naval navy as well as in the private sector. We'll talk about that. And Dr. Ashish Kakar is a very dear friend. He's been with us in the Indraprastha Apollo Hospital for a long time. Uh, he's also professor, and his senior consultant in our hospital, dental surgery. And he has got a very impressive dental clinic very close to my home. So when I have trouble, that's where I look at.
Okay.
Um, Fantastic clinic, and he has further modernized it in COVID times with some more innovative ideas. He'll describe about them, and he's also Rashmi and alumni of New Jersey
Yeah.
Dental School, Rutgers, and he's a visiting faculty there. At one time, I used to ask him, Ashish, I don't see you here. You're hopping around between US and Delhi. How do you manage your practice? So, well, probably he'll tell us something about that
Sure.
too. So, welcome, gentlemen. It's a real delight to have you, not in the consultant forum room, but on Rashmi Bedi and Janak Bedi's channel, which is doing a great job in health talks. So, welcome.
Welcome to the show, Dr. Neeraj, Dr. Ashish. It's an honor to have both of
Thank
you on
thank
our
you,
show.
thank you, thank you so much, Dr. Kanwar and Rashmi. We are glad to be here with you today. And Dr. Kanwar has always been inspiring us at various level, and like he said, in room number 1116, that is where we all get together sometime whenever we get a break. And of course, professionally, he's been leading. He's become a kind of an icon, and he's leading the team for the, corona against the coronavirus in the hospital, and is very, very laudable job that he is doing.
Absolutely.
Thanks to him.
Thanks, Neeraj. And let's start with you, Neeraj. I mean, what have you been? I know your practice was, so busy. You just managed to get a few minutes to have a break, a coffee break, and you would rush back to your room. But what happened in once the COVID set in? So how did the change come in, and what did you do, and how did you sort of alter your practice pattern? So how did you manage all that?
To tell you, really, I'm enjoying it. I'm kind of the long awaited break that I got after so many years. I don't remember ever taking an off for more than 12 days. And that is when I go frequently to my son, close to Rashmi, where she is in New Jersey.
Oh,
He lives in Matawan and he is working for Amazon there. And that's the maximum break that I have ever taken in my life for not more than 12 days. So it's a long awaited break and I am enjoying myself. In fact, dentistry is the one which has had the maximum hit as far as professionally is concerned. I don't think anything else has been hit so badly in any other thing. People can work from home, people can do consultation from home, but it becomes really difficult in dentistry to perform uh, tele like telemedicine. Most of the time, you do what is just give a medication to relieve the pain. The pain relieving is the only thing that we can or advise some precautions, preventive measures that you can do it from home. But by and large, it has taken a hit, but slowly it's getting back. People have learned to live with the virus, and they will probably get into the work. We are also doing our bit to get back to the work, whatever we can, and we will, during the course of our discussion, we'll come to it that what and how we manage the coming in problem as far as dentistry is concerned.
Yeah. And Ashish, how did you change your practice pattern when the COVID hit came? Because it was like closing down all the dental clinics. I remember there was a time in the beginning when no dentist was available to public. How did they manage? How did the public manage? I know when you have dental pain, man, you need help.
Of course.
So, what was your reaction when people were calling you or your secretaries for help or for appointment or something? So, what was your response and how did you manage that?
Well, the initial response was of scare, both for the patients and for the doctor. You know, I remember on 14th of March, I came into the hospital wearing a N95 mask and a face shield. And one of our consultants took a picture and put it up on a group saying that, next thing he's going to wear a spacesuit.
No.
Fair enough. 2 weeks later, the same people called me and said, where can I buy a face shield from? So the initial reaction was of scare, and scare for the right reasons, because of the fact of the proximity that we have with the patient, the close proximity, and all the aerosol which was being released, even while breathing. And so, yes, initial reaction was to just shut down and, stay indoors because we didn't know what to expect. Slowly, over a period of time, as Dr. Neeraj mentioned, some teleconsultations were done, basically to relieve pain, and that was really it. But once June, July, August set in, we knew that this is going to be the new normal. We need to adapt ourselves. We need to adapt our practices. We need to adapt our habits and our culture, the patients' waiting areas, everything according to the new normal. So slowly we retrofitted a lot of new equipment, a lot of new techniques, a lot of new protocols to adapt to the current situation. And now I can say within the last maybe 10 days, we are more or less seeing all kinds of patients, which were limited to emergency care maybe about 4 to 6 weeks ago.
Rashmi, here I must tell you that both the gentlemen here are also co-authors in my book that we are coming up on Corona. Yeah. They both have contributed chapters. So fantastic. When I read the way they had written, I could see the kind of difficulties they are going through, and we knew that, but learning from them, reading what they had written, it gives more insight to us also. Dr. Neeraj, normally in your normal practice, what is the commonest complaint people come to you with? Whenever I come to your room for some issue, I always see somebody lying on your dental chair. So what is the commonest thing that the people bring you themselves to you for? Is it a RCT or some kind of cosmetic stuff, or what is it?
See, dentistry is a combination of the medicine, managing the pain, and as well as also the aesthetics. When you come to the dentist, one of the main symptoms or the main cause for reaching out to the dentist generally is pain. And this pain could be for many reasons. It could be because of the swelling in the gums, because of the bleeding in the gums, or maybe a decay in the tooth, or maybe a little trauma that has caused the fracture in the tooth. Pain is the main reason a person really reaches out to the dentist. And then let me just add a little more here. The severest, most pain that I know of in the body is because of the pancreatic region. After that, the next severity in the pain comes the dental pain, which is very, very difficult. It's a very acute pain and difficult to bear it. Other pains like labor and fractures and things like that come much later in comparison to the severity or the acuteness of the pain. So, having said about the pain, the other reason for a person to come to you is a bad odor or the bleeding from the gums, which is one of the most common disease as per the WHO. Almost 99% people suffer from periodontal disease after the age of 40. So let's say any adult has certain amount of swelling in the gums, starting from gingivitis to the deep periodontitis and other. The other reason that can be there because of the orthodontic requirement, that is for the braces or teeth looking ugly. They want to remove the stains from the teeth, the bad habits that the people have, pan, tobacco in India, and maybe other places, the other habits and all. These are some of the reasons that the people reach out to the dentist. But commonest thing that one reaches, if I say out of 100, the 75% plus will be because of the pain or the bad odor or bleeding from the gums.
Right. When you say that the pain rates higher than the labor pain, then Ashish, I've had worse than a labor pain. Rashmi, are you listening?
Of course, Dr. Kanwar.
I myself had worse than a labor pain in that case. Ashish would remember that I was on a flight from New York via Dubai, and I started pain almost soon after the flight started. And God knows how I reached Dubai. And the moment I reached Dubai, I called Ashish. I said, Ashish, I'm in terrible pain and I don't know what to do. He said, oh, really? Pop in this thing. Are you carrying this medicine? I said, I've taken it. He said, take one more. I said, I've taken that.
Oh, no.
Then he says, all right, do this. He gave me another thing. I said, I've taken that also. He said, then, okay, then take an antibiotic. I said, I had Augmentin. I have taken Augmentin also. Then he started thinking. Then he said, do you have a clove? Look, I said, when I travel, I don't carry clove in my pocket. But I still searched in the lounge there if I could get a clove. I couldn't get it anyway.
Yeah.
So how I managed that flight right up to Delhi, I continued to have pain despite all that Ashish suggested to me, and I kept popping it up in actually double the dose and everything, you know. And then anyway, next day he sorted it out. But so I have gone through something
Of
which
course.
Dr. Neeraj says is supposed to be worse than a labor pain.
Totally.
So
I definitely.
Rashmi, don't think only you guys suffer. We also suffer.
The whole world is suffering with this thing, and of course, my
May I
viewers are
butt in?
texting me कि दांत का दर्द बहुत पीड़ादायक होता है. Of course, yes.
Yeah,
So,
There is a
yeah.
joke about it.
yeah.
Majid, can I say?
जी.
That the lady goes to the dentist and says, I will rather have a lever pain than the tooth ache. Dentist says, lady, you decide, what do you want? You want me to settle your tooth or you're looking for a lever pain?
Oh God.
Anyway, you should have put a swab of alcohol,
Yeah.
which could be easily available in the aircraft, onto that tooth where you wanted to put the clove. It would have helped, partially anesthetized.
Yeah.
In fact, Ashish suggested have this, have that, have alcohol, have one drink, two drinks. I said, Ashish, for this pain, I have had four drinks. It is still on. So that was a very
So
bad, that was the worst experience I ever had.
yeah, I am telling, pulpitis pain is very, very severe.
It's,
I have been
Yeah.
woken up at night many a times because of this.
Of course.
Yeah. Ashish, let's come to you. Um you said that, and Dr. Neeraj also said, and you also said that you have started coming back to your normal life as a dental surgeon, and I can understand that you must be taking a lot of extra precautions. I also remember that when you started the procedures, you started take them in uh, OT rather than in the outpatient, and with the strictest of the protocols. But now, are you back to full strength in the outpatient or in the OT area?
well, as of
OT is
now,
operation theater, Rashmi.
yeah. Okay, so OT is like the OR that we have in the US. So initially, we were taking all the patients to the OR because of the strict infection control, and more because of the air exchange facilities that we have. The air exchange which happens, every 10 minutes in the OT. So even if you have some sort of a virus in the air exchange helps you. Number two, because of the fact that there was all kinds of personal protective equipments available, and again, we were restricting ourselves to very, very basic and limited procedures. As of now, I mean, you've treated me, so I was infected way back in July, and we tracked it back to again a patient, and that was the worst fear that we
May
had.
I
That
interrupt you here, Ashish? Rashmi, for the viewers, Ashish got COVID
Oh,
way back in, when was it, Ashish? July or when?
week of
No,
July,
earlier than July.
first week in July.
So he got it in July, and but he got more panicked actually than he should have. So he rushed to the hospital when I wanted him to be at home only, and then he decided that, oh, he's feeling fine and he should go back. And then when he goes back home, he gets a little breathless, and then he wants to come back to the hospital again. Ashish, that was the storyline. But
The
the
SpO2
point is,
quite rapidly. You remember that, but
the
anyway,
panic.
thanks for pointing out,
But
and yeah.
this was the hazard of this being in this profession, that Ashish was, of course, quite vulnerable. So whatever he tried as examining the patients or doing some procedure, so somebody must have obviously infected him. So and he had to suffer and had to have a break. Though I mean, in COVID times at that time in July, they were not very active in seeing patients, but he had to step down and be cautious and be treated, and was quite vulnerable also emotionally, because the oxygen was fluctuating a bit. So anyway, he pulled it through, and he's back to his work. And though we know that there can be a reinfection also, and there are cases of reinfection also, and I'm sure that the people who have one disease once, they are mindful of the fact that they cannot be just feeling that they have enough antibodies or T lymphocyte, kind of immunity in their body, and that they are not going to get infected second time. This is happening, and quite more and more cases are being reported. So I'm sure not only Dr. Neeraj, but Dr. Ashish, who's got the disease already, he is very mindful of that. He'll be very careful. Ashish, tell me about that. The vacuum sort of stuff that you have, sort of you were showing me in the picture. A lovely way that you could, when you generate the aerosols in your procedures, you can suck it out so that, the concentration of those, if the viruses are around, is minimized. So how have you done that?
So let me just explain to the viewers what an aerosol is, because I think a lot of viewers will not know what an aerosol is.
Of course.
So Rashmi, and what happens is when you talk, there is air mixed with saliva that comes out, and a lot of times you're able to see that in people, especially who sneeze or cough. But a lot of these droplets are not visible.
Yeah.
So this is the aerosol which is generated naturally. And the louder you talk, the more aerosol is generated. It's already been documented. Let me give you a very quick example. In March, there was this thing in Saget County in Washington, right where we had the first few cases in the nursing home, if you remember, from the same town which has this big Sam's Club and everything. You remember that town? So there was a orchestra which was practicing and they were doing some singing. So there was about 61 people who were singing, and one of the persons was infected, who was COVID positive. And about 6 days later, there was 32 confirmed cases within that group because they were practicing for 2.5 hours, and 20 probable cases which were infected later on, which could be tracked. So the aerosol effect is quite a bit. 3 people actually ended up in the hospital, out of which 2 died. So this has all been documented. So that actually scared everybody a lot, from a dental field, from anesthesia, from ENT, all people who deal with aerosols and who have very close proximity to the patient. So similar thing was had to be taken care of in the practice. So there is an extra oral vacuum which is now being generated, which actually pull this aerosol. It's like a small funnel or a chimney like you have in the kitchens, which pulls smoke. Something very similar to that, but much, much more powerful. And that is one of the more, I think that is the equipment of the decade for me, for dentistry, because that is something which is here to stay. And that is the invention of the decade for me. So that actually device helps us to take away all the aerosols, all the fumes, all the material which is being cut in the cavity, or all the secretions which are in droplet forms. And we all know that the virus actually comes into the droplets and then enters your body through a pharyngeal or from a nose or from a mouth route. So that's what we need to prevent.
That's really nice and very well explained, I'll say.
Thank you. So that is Dr. Kanwar. That's what we've got one at the hospital as well. And I think it is really helpful for our patients, especially to prevent cross-contamination. And these aerosols stay in the room for several hours. They just get extracted. A lot of it will remain for several hours. So there needs to be a downtime to let these particles settle down and then clean the surfaces with a very strong disinfectant.
Okay,
Dr. Neeraj, when you see, sorry, go ahead.
No, I do have a few questions. I can take 1 or 2 now, and then we'll continue it later. Because I'm getting text non-stop from our viewers. So I want to ask Dr. Neeraj, how people with systemic condition take care of oral health?
See, among all the health professionals, dentists, being ENT, eye, anesthetist, or even pathologist, dental surgeons are the one most susceptible because they stay in long hours in the close proximity to the oral cavity. The others do come close, but they can, get away with short exposure. But when we work on a patient, we work for long hours and we work down there into the mouth. And like Ashish just mentioned, that we have now invented this kind of a thing of high vacuum suction, which does help in sucking out some of these aerosols, rather most of these aerosols which come out of the mouth and get sucked into this mouth. But having said that, WHO had recommended to delay the dental procedures, if it is not really necessary, for a long time, which American dental associations had said, or rather they have issued a notice that respectfully but strongly disagreed. And since May onwards in US, the routine dentistry is taken off. And same thing is now slowly and slowly happening here in the India also. And now, having said this also, I'm telling you that there is no significant evidence that the transmission is being frequently recognized being done in the dental offices. There are not many evidences. You won't get any study or literature where it says that there is a significant transmission being conveyed from the dental
Actually,
district. Why so? Because dental surgeons have been, practicing these precaution against the infectious disease even before the outbreak of coronavirus. See, dentists are in a fact have very frequent habit of washing their hands frequently. They work with the gloves. They've been using the what do you say, mask very frequently, even before the outbreak of this. And uh, this has been in their habit, and they developed this habit very strongly because of the past history of hepatitis and AIDS virus and all, which they thought that it can be contaminated. And there were cases about the AIDS being transmitted from the dental office. But in these 7 8 months of all this coronavirus outbreak, but they have not been. I have been looking for this study. There is none. Rather, it reports that there is no significant transmission. You won't have heard many dentists dying because of the coronavirus or getting infection in the dental office. It could be. Dental surgeons must be suffering among. They are also health workers. They move around in the hospital, but dental offices are reasonably safe, and this has been,
If I
strongly
if I
recommended
remember
by the.
correctly, Neeraj, if I remember correctly, in the beginning, when the coronavirus was in its early days of spread, there were there were quite a few cases among the dental surgeons, dentists. In fact,
Like
there were a
anybody
few.
else,
There
dental
were a few
surgeon
deaths
may have
also.
suffered.
Yeah, initially in the early days, and we could actually relate to that because we thought they were in a very close contact. But I think good sense prevailed, and the routine work was stopped. Only some very emergency work was taken up, as you both are doing were doing at that time. So probably the dentist got alerted that they have to take it easy, otherwise they risk their lives. It did happen in the beginning, but anyway, it was taken care. Now, tell me, among both of you, do you, after each patient, do you use sodium hypochlorite to clean up the
Oh yes,
surfaces,
of course,
an area,
of course. There is a
after
there is a
every
drill in the
each procedure?
hospital that every patient, as soon as he walks out, we give it a break of 10 to 15 minutes to clean up the whole thing, because the staff and everything is already ready, prepared. That after every patient, the certain drill has to be carried out to clean out everything with the sodium hypochlorite and all the other drills. If you want to discuss, we can discuss them also one after the other. But those are the frequent things.
Okay.
Yeah. So, Ashish, you're doing the same thing, clinic
I,
also.
the protocols are pretty standard right now worldwide as to what surface is required, what chemical disinfectant. We know that hard surfaces require and floors require hypochlorite. For fumigation, I think in a dental environment, hypochlorous acid works very well because it doesn't corrode our instruments and it doesn't corrode the circuitry in our equipment. So that's a 600 ppm of hypochlorous acid is very, very well documented. For fabric, you can use quaternary ammonium. I mean, there's standard protocols worldwide which have been followed, and all these chemicals are always freely available. I mean, there is no shortage of any chemicals or any disinfectant or any face mask or personal protective equipment. So it depends on how far you want to go to protect your patient, yourself, and ultimately your families, because you're going to bring the infection home. Even if you don't get infected, you can be a carrier with your clothes or with your shoes or whatever. So everything is available to disinfect the surfaces. All needs to be done is to figure out a time period, the downtime for each patient, because the room needs to be prepared, as Dr. Verma said. 10 to 15 minutes probably is good if you're doing examination. If you're doing an aerosol procedure, you need to fumigate, use a UV light, a tower kind of at least 100 watts with a 15-minute exposure to kill all the bacteria. And also, it has been now proven that UVC light is virucidal in nature, especially against SARS-CoV-1 and CoV-2 as well. So there has been some research done on that. So that obviously all these protocols should be followed, and the more involved, the more time you spend with the patient, the stricter the protocol should be for that particular cabin wherever the work is being carried out.
Great. So that means actually that the patient should not be worried about a cross transmission, that as they have been thinking, that they have been worried about going to the hospitals and just with the fear that they may get infection from somewhere. I think so. It encourages the people with dental problem to go to the for their routine work also to the dental offices. Rashmi, you have questions, please.
Yeah, I do have, but it's something going out of link, but I do have to take these questions. One of our viewer want to ask, what about the Dr. Ashish? Stainless steel crowns are being suggested these days. What do you think? Is it good for long run?
Depends on the indication, depends on the age of the patient. Usually, stainless steel crowns are used and more in pediatric dentistry for children with grossly carious teeth after doing a root canal or a pulpectomy kind of a situation. So, I mean, it's a very generic question. It's difficult to put a clinical scenario into
Mm-hmm.
it. But yes, there is a place for stainless steel crowns in our practice, but I think it's quite limited. So it's always better to go for custom-made prostheses or crowns and bridges, especially with the new technology with digital dentistry being available to us.
Yeah, I do have a question. They want to know, like, how do you deal with people having dental anxiety and fear? Dr. Neeraj.
Yes, this has become a really, in fact, I was reading in one of the article, it says that recently the dentist has been seeing more cracks in the teeth. And it has all been related to the stress.
Yeah,
People have been getting the myofunctional pains because of the stress, or TM joint pain because of the stress and anxiety of the COVID and
yeah,
the other things. So ill effect of the stress as far as teeth are concerned, these are the few things, the cracks and the myofunctional pain and all. So there are medication, there are night guards which have been prescribed. The practice of the night guards in US has increased since the time the COVID has outbroken in the States. Others will follow slowly because we all have the same what is going on in the developing places. So there is a stress, definitely, and that stress is showing its effect on the teeth as well as on the jaws and the muscles of the face.
absolutely.
And there are medications, stress removing medication, the counseling,
Just
the
add a
removal of
little.
fear. Like I said, that this hype that the dental infection is more likely to come from the dental office has to be eliminated. I mean, people has to be assured because a well-managed dental clinic is very safe, safer than many other places in the hospital, I would say.
Absolutely. Thank you so
Because
much.
dentists have been fighting infection. They are experts in dealing with the infectious diseases even before the outbreak.
Absolutely. Absolutely. So, Dr. Ashish, one last question for you. How to get rid of parafunctional habits in kids?
This is again rotating around the fact what Dr. Verma had just pointed out. So parafunction in kids could be due to several reasons. It could be due
She's
to
asking regarding thumb sucking and nail biting. That's the problem she's asking for.
appliances available. Dr. Verma is doing a lot of orthodontics. I'm not an orthodontist, but he does. So there is appliances available to break these habits. Dr. Verma, would you like to please elaborate?
I'll add to it. See, there are many reasons that the children develop these habits of different kinds, like biting on a pencil or a pen,
Yeah.
sucking thumb. See, it's thumb sucking up till the ear, or even the dummy sucking, where is very prevalent. These are very common thing among the children. Until the age of 3 years, it doesn't have any adverse effect. But as long as it is weaned out after the 3 years of age, it is safe enough. But if it continues for a long duration after 3 years till the 16 years or 18 years, the girls and boys grow. Their jawbone grows, and these parafunctional habits, like you said, thumb sucking and tongue thrusting or biting on a pen and all, they create extra force in the wrong direction. And bones can be remodeled according to the force it is applied. In normal circumstances, your cheek, lip apply a certain force whenever you swallow, and the tongue also applies a reverse pressure from inside whenever you swallow. Try and swallow now, you will see you can't open your mouth and swallow. But you can't even swallow without touching the tongue onto your palate. So these two maintain a balance. And as long as this balance is maintained, the dental arch is well formed. Whenever this balance is broken, the abnormalities will happen.
Oh.
So to break, and these habits generally are more related with the stress amongst the children. And the stress among the children could be very different kind. The child has been debarred watching a TV. The parents been fighting, child is being punished. So they will develop into these kinds of habits. And sometimes what the remedial measures the parent do is they fire them, they get angry on them, they sometimes even thrash them. Those things will aggravate rather than reduce it.
No.
The minute you are away, the child thumb will go back into the mouth. Whenever you are there next to him, he will remove the thumb. So these are the things have to be taken care of by proper counseling of the parents to the dental surgeon, the orthodontist. They will explain them that how you can help your child avoiding the stress of school, of peer, or parents, or various other kind of thing. And to tell you very frankly, I have seen children do follow. They behave. I have done it. I have corrected this problem in many children who you have to recognize that what is the reason, what is the cause of their stress. And if it is well explained rather than punished, you can do that. But in spite of that, if it doesn't work, then there are various removable orthodontic appliances. Like kind of there is a thumb reminder. So there is a appliance which is put onto the palate. It's like a denture. You put it in a mouth, you can even remove it also. And as soon as the child puts his thumb into the mouth, those wires, they will remind his thumb that no, you have to remove it. He can't suck. The same thing is about, developing a swallowing habit to the child. So there is an appliance to help child to make swallowing proper. In fact, Dr. Kanwar, it comes into your specialty also when we talked about the sleep studies and all that. And there are appliances to improve the, what you have, the problem in the sleep. So these are the appliances which can be given to children according to the different requirement, according to recognizing what exactly is the problem.
While we're
Thank you, Dr.
talking about
Neeraj.
children, Dr. Neeraj, at what age do you think, if the teeth are appearing very malpositioned, at what age do you want the parents to bring the children to you so that you can give them advice as to what should be the next direction?
Yeah. See, the first appearance of a baby tooth in the mouth is at the age of 6 years, as we all know. The front two teeth appear into the mouth at the age of 6 years. And that is the time that the child can be seen first time. And slowly over the next 6 years, from 6 to 13, there are more teeth slowly and slowly at different interval coming, starting from the front teeth to the back teeth. There is a time table for that. And after 12 years of, by 12 years or 13 years of age, all milk teeth have come, and then they start even falling. The 6-month tooth will start falling, the baby tooth will start falling at the age of 6 years. And then it goes on till 13 years of the age when all the milk teeth have gone. There are 20 milk teeth, there are 32 permanent teeth. Of course, there are variation, but there is an age around 7 or 8 when you have almost like 40 teeth in your too small jaw. See, at 8 years of age, how big is the jaw? the child is only 8 years. But then there are permanent teeth which are developing in the jaw, and there are mill teeth already there into the mouth. So there is a havoc taking place. But then growth is such a beautiful study that slowly and slowly the jaw grows, the mill teeth fall, the permanent teeth which are bigger, they come into the mouth, and they also induce the growth of both the jaws. So this problem of irregular teeth or crowding of teeth can start from early age of, I said teeth will come at 6, but then the growth is taking place from the time the child is born. In the first year, the growth is maximum. You see a child born of about 3 kg or 2.5 kg, and in 1 year time, he grows so big. If that speed, if the growth takes place, the child will hit the roof. But at 16 or 18, it stops. And by then, the jaws have completely grown into your mouth. So, recognizing the problem, the first initial problem which orthodontically for realignment of teeth or for disfigurement of face, which can come is a cross bite. Cross bite, when I say, means the lower jaw is going forward than the upper jaw. And if that is not corrected early in life, it will grow in that direction.
Oh,
And you will have a face like a chimpanzee. So it has to be
okay.
corrected. And once you correct this, you save a lot of problem for future. But if it is a normal routine crowding problem, then 13 years is the best time to start the treatment for the braces, for the crowding of teeth. When all mill teeth have gone and the permanent teeth are in position to be corrected. Before that, correcting the crowding, there's no point because it will again happen because more teeth have to come.
So
Well,
braces,
lovely. Beautifully explained. Yeah.
yeah,
Yeah, Rashmi.
of course. And braces ka, I wanted to ask that is there any age or then when you can have them or any like little bit later
See the
ages when you
permanent,
want to get fixed your
if you call the braces, I don't know, people have a different concept about the braces. If you're talking about the braces which we fix on your teeth and then put the wire to correct the thing and all, that is the ideal time. I said is after 12 years. But it can go on even an adult at your age also. There was a time when I was treating a mother and a daughter together. She
Yeah, you
daughter was
answered
about
my question.
16,
Her age
17,
is
and the
40.
mother.
She's
So,
asking me, can she have it now?
yeah, she can. Yes, she can have it now. Though the time taken for correcting at later age is more because the bones have to be remodeled according to the
Absolutely.
pressure that we apply, and the bones are more stiff, more rigid as we grow, the more calcified. So it takes a little longer. And the satisfaction level, the correction is not as good as you can achieve at the age of 13 or 14 when you can take the advantage of growth also. Because
Perfect.
at 40, you're fully grown.
Yeah.
So your jaws are not growing.
Yes.
I have to create space in your jaw by removing some teeth or something like that.
Thank you so
Yeah.
much.
But can be
Lovely.
done at 52.
Okay.
Mm.
Great.
Okay. Okay. Ashish, let's go a little bit away from orthodontics. You have been into cosmetic surgery also. Rashmi, Ashish has done some work, I'll not name, for somebody cosmetically giving the shape of somebody else, because somebody has to do some acting. So he has done some work
Okay.
based on the facial features of the original person and the person who is going to act. He has done work on that. Ashish, would you
Wow,
give me some
interesting.
idea about that?
Yeah, we would
Yeah.
like to know about that.
So basically, it's something similar to what was done in the movie Queen to replicate Freddie Mercury's teeth.
Okay.
So there is a certain sports person whose movie will be coming out in somewhere down the line.
Okay.
So we had to kind of replicate his dentition to make it look more authentic. So we had to do a scan, like a full facial scan, and then a teeth scan, and then superimpose those, and then had to make an appliance which would kind of fit so that this person could, get a very authentic look. And I think the results have been very encouraging, and you will probably see this movie come somewhere down the line. It was supposed to be released in April, but I think now it's going to be December or January later on this year. So that's what, as Dr. Neeraj said, you have two sets of teeth. God has given you two free sets of teeth. The third one you have to pay for.
Absolutely.
And the third one you have to pay for. And sometimes, no pun intended, through your nose, because you really have to pay a lot,
Yeah,
especially if you're going for extensive dental cosmetic work or reconstructive work.
absolutely.
Yeah. Something very basic. Do you what toothpaste or what kind of brush do you advise people? I mean, it's something very basic question, but this is something which concerns everybody,
Of course.
and
And bad
young
smell
and
is so
old.
many questions
What
I
kind of
have,
brush?
and I was supposed to ask this question, Dr. Cover. It's good you are asking
Yeah.
it, so we really need some limelight on that too.
What kind of brush and what kind of paste?
Yes.
Okay, so the brush and paste is a story like a salt and pepper. It's actually not the brush or the paste, it's the way you brush which makes the complete difference. And there is evidence. I mean, I've done a lot of research on dentifrice and toothbrushes and devices, and it's just the way you brush that is more important, and the timing of the brushing. See, basically, all toothpaste contain what? If you know, the toothpaste companies were all soap companies. So the toothpaste contains sodium lauryl sulfate, which is the same thing as what you have in soap. So basically, it contains soap, it contains an abrasive to clean the surfaces. Now, it could be a silica base where you have gels, or it could be a calcium carbonate base where it could be a white. And then different flavoring agents, certain fluoride, anti-cavity agents, So, it's just like every few months, every few years, these companies have to come out with a new package to excite the public, because everybody is now sick and tired of seeing the same old red box on the shelves of the supermarket. So they need something new. So they will come out with a striped one. They will come out with something with different flavor, or there is a company in Switzerland which is making gin and tonic flavor toothpaste. The same company makes a gold leaf toothpaste, which costs like a fortune. And I asked this gentleman, I had a meeting with him, a Skype meeting with him a few days ago. I said, who affords that? He says, in the Middle East, this is selling like hotcakes, because these people have a status symbol like a gold leaf they're using in their toothpaste. So, I mean, ultimately, it's just the way you brush and how often you are brushing that is more important than the actual brand of toothpaste. Obviously, the sonic toothbrushes work better, but then again, they can do a lot of damage, the motorized brushes, if you don't brush with them properly. So my advice to everybody would be to stick with whatever they are doing, but get a good brushing technique where they need to brush more vertically instead of brushing horizontally, because the enamel is the thinnest around the necks of the teeth where the tooth meets the gum, and that is where the maximum damage can occur.
And what
So
does it
it's
matter, like soft, hard, and medium? Like, does it make any difference?
Of course, it does. I mean, a softer brush is always better. But if you are, a softer brush will also open the bristles very quickly. So a lot of people like to use medium brush. So my recommendation to them is just run the brush under some warm water so that the bristles soften a little bit, and they would probably then get the same effect as a soft brush, and the brush would last longer. But a hard brush is definitely, which is it's more for people who have more calcium, more minerals in their saliva, which tend to form more
Yeah,
tartar.
yeah,
That's
yeah, I'm understood.
Right.
Yeah.
Excellent. Rashmi, we've had some excellent time with the two gentlemen here, and we've gone quite a lot onto the basic dentistry and a little more of a bit of a complicated and even cosmetic procedures. You have more
So,
questions?
Dr. Kanwar, I think so. We need to invite them one more time because I don't have few questions. I have too many questions actually, and viewers have started calling also. So,
Yeah.
viewers, today we are not taking calls, and we will definitely invite them one more time because this is such a topic which, a lot of kids are having problem, and parents are really looking forward that they should have people like you on our show, so they can get solutions for their queries. So I think
Yeah.
so, Dr. Kavar, we can have one more session with them. And
That,
viewers,
yeah.
sorry
Yeah.
about that
And
for not taking your
you
calls
should.
today. And we'll definitely invite them
You
one more
should.
time.
Yeah, Rashmi, you should make a bank of all the questions that people are asking,
Yeah,
so that at that time you're not waiting for them to be throwing their questions. You have them in your bank, and we could
absolutely.
kind of start discussing
Yeah,
those issues, their problems right away. And Rashmi, this is a free consultation happening in the US,
of course.
so it's a very expensive thing over there. It's a free consultation,
Of course,
so
eye and dental is,
if they have,
it's so expensive here, and of course, our viewers are looking forward to have doctors regarding eye and dental, and it's actually very beneficial. And this is actually a great session we had today, and of course, I've texted a lot of my viewers that we'll be inviting them one more time so we can have some calls and they can talk directly to our doctors.
great, yeah. And thank you so much, Dr. Neeraj and Dr. Ashish. It was a wonderful session. We enjoyed, I enjoyed, and I'm sure the viewers enjoyed a lot. Rashmi, you did. I could sense from your laughter. You really enjoyed
I
the
really
session.
enjoyed
And
this session, and I know the person who was calling me, she really wanted to talk. Maybe I'll give your number and that they can talk to Dr. Ashish or Dr. Neeraj after our show. I know she really wanted to talk, and next time definitely we'll be having a session when viewers can talk to both of you.
all right,
Yeah, it was really very
yeah,
informative
that would be
Thank you.
session.
better.
Yeah,
That would be better. We can put the viewers directly to the two experts.
of course.
That is
Thank you.
great.
Yep.
Thank you very much, Dr. Neeraj, Dr. Ashish. And stay safe, stay healthy in Corona times.
Yes.
And now that you're getting back to your normal routines, please be extra cautious.
Of course, you are
Thank you
our
very much,
heroes. Thank you
Rashmi.
so much for being part of our show. Thank you so much for your time. Thank you.
Glad being here. Thank you. And good
Thank you,
night.
Doctor.
Good night. Good night.